The London Orthopaedic Clinic consists of a team of expert consultant orthopaedic and musculoskeletal surgeons and physicians, and we offer a private health care and medical and surgical care of the highest standard using the most up-to-date and cutting-edge procedures. This includes the latest surgical and non-surgical techniques featuring minimally invasive procedures for joints, sports injuries, fractures, orthopaedic and musculoskeletal problems, along with specialising in orthopaedic medicine, degenerative neck and spine and pain conditions. Some examples that our consultants are skilled in are minimally invasive surgery for bunions, joint replacements, arthroscopy for wrist, elbow, shoulder, hip and knee, foot and ankle. We also offer treatments such as platelet rich plasma injections, which is called PRP. This is a treatment for damaged tendons, ligaments and muscles, and a new procedure called shockwave therapy, which is a pulsed ultrasound to treat tendinitis. I personally think we're different and foremost in London, as we offer a team of highly qualified specialists providing treatment and orthopaedic surgery for the lower limb, such as foot and ankle, hip and knee, upper limb, hand and wrist, shoulder and elbow, soft tissue injuries, musculoskeletal health, degenerative spinal problems, and also sports rehabilitation for most ages and fitness levels. Most importantly, we work together as a team and also work with various other clinics and specialists for a more holistic approach to strive for the highest standards of care for all our patients.
Platelet rich plasma, also known as PRP, is a new field in orthopedics and sports medicine, in which a patient uses their own blood for healing muscles, tendon, and ligament injuries. A common form of healing is scarring, which affects function and is accompanied by increased risk of further damage and also symptoms of pain. Current therapies to treat these conditions involve long-term conservative treatments that do not really change the fundamental poor healing properties. Over the last decade, medical science has recognized that several blood components take part in the natural healing process. These specific blood components include growth factors. Growth factors are biologically active proteins which increase blood circulation and the progression of healing of injured tissue. I know it all sounds quite scientific, but basically PRP is derived by placing a small amount of your blood in a filtration system, which then separates the red and white blood cells from the platelets. The high concentration of platelets containing the high concentration of growth factors is then injected into the injured tissue, which helps the body's natural healing response. PRP can be used for such common painful conditions as golfer's elbow, tennis elbow, Achilles tendonitis, muscle and ligament strains. It is considered by our patients to be a natural procedure as it uses its own blood. Patients also appreciate that it's a non-surgical procedure. This is always a bonus.
The London Orthopaedic Clinic uses computer-assisted surgery to ensure highly accurate joint replacement surgery, optimizing the quality of patient care and post-operative results. Computer-assisted surgery uses special probes attached to the body to help ensure proper positioning of the joint replacement implants. The probes are detected by an infrared camera that is connected to a computer terminal. The computer terminal constructs an electronic model of the knee based on the information gathered by sensing the position of these probes.
Yeah, so we're just mapping out the points in the knee, so the surface anatomy of the key bits of the knee that we're particularly interested in. And the computer is creating a three-dimensional picture of where we are. This is the top surface, the front surface of the shaft of the femur. And that's now the computer knows where the centre of the hip is, it knows where the centre of the knee is, it knows where the front surface of the femur is, and it now knows the correct rotation of which way the femur sits. And again, now we're going to say what's the inner aspect of the knee, the medial side of the knee. So it's now picking up a reference of, it's done that. Done that. So it now knows exactly the peripheral surface of this femur.
The computer can help guide the placement of the knee or hip replacement implants to ensure proper positioning of the joint replacement. One of the most critical aspects of a joint replacement surgery is to ensure optimum positioning of the implanted joint. An incorrectly aligned joint can lead to early wear and loosening of the joint replacement, as well as stiffness and pain. So we use computer-assisted joint replacement surgery in order to ensure a replacement joint is accurately placed to improve function and avoid failure.
We offer surgical and non-surgical management of minor fractures and major trauma. We also diagnose and treat other patients and injuries ranging from professional athletes to West End performers, etc. And they have such busy schedules, and also their injuries occur the worst time of the day, not between 9 and 5. So we need to offer a program for them and access to our services, so our consultants are committed to treating them after hours. So that's brought about our 24/7 emergency service. Our surgeons, physicians also use modern evidence-based practice, the latest techniques for not only treatment of injury but prevention and education. Patients need that service as well. Our physicians in our back pain, spinal pain unit treat spinal degenerative problems with the aging population, spinal disorders and diseases, and it's terrible watching these patients in such pain, but our team are so dedicated to them and give that full service. Also occupational health, your back may have had some twinges now and again. I know mine has. And if you have to go off work with back injuries, it needs to be treated by an expert. Our consultants are also used to individually tailoring their care to each patient's needs, because each patient's different, comes from a different background, has a different genetic makeup, so you can't treat every patient the same, and this is what our consultants and our auxiliary staff are dedicated to.
London Orthopaedic Clinic does not just deal with major procedures and surgeries. We understand problems occur in individuals at different stages of their lives, from painful foot and ankle problems to severe hand, wrist, hip, knee and all musculoskeletal injuries. London Orthopaedic Clinic has specialists in place to help deal with them. We offer solutions and procedures for conditions that are painful but do not need major surgery as well. For example, plantar fasciitis is a painful condition in the feet that we diagnose and treat. Osteoarthritis, bunions, ingrowing toenails, Morton's neurometer are just a few. Treatments for osteoporotic fractures, carpal tunnel syndrome, ganglions, cysts, bursitis and sciatica are a handful of orthopaedic conditions that the London Orthopaedic Clinic take pride in treating well.
London Orthopaedic Clinic's team of orthopaedic surgeons and physicians can offer comprehensive expert care from pre-surgical assessment through surgery to a structured and supervised return to function programme. We use the most modern equipment and are all skilled in the latest surgical techniques and procedures based on evidence-based practice. We're constantly pioneering new techniques and procedures. Our surgeons will use minimally invasive and image-guided techniques wherever possible in order to avoid open surgery, and so patients can be assured they'll have minimal downtime and will be able to return to normal activity and training as soon as possible. We also hold free monthly education sessions for GPs and all allied health professionals, which are not only open to independent sector but also to the NHS. This has proven to be very successful, as there is so much we can learn and also share with all healthcare professionals in London. It's crucial to regularly communicate with both sides of the healthcare sector. If anyone is interested in our education programme, please visit our website for details to register. Our consultants and allied staff are committed to providing high standards of care, both in working hours and also to extend an urgent care service when patients most need it, after 9 to 5. Skilled consultants with the highest standards, teamwork, communication with our patients and linked clinicians is the way to our success at the London Orthopaedic Clinic.